The purpose of the Virginia Health Reform Initiative was to look at health reform nationally and to see how it could be implemented best in Virginia. I was actually assigned to the Medicaid Committee of the Virginia Health Reform Initiative, and our task was to look at the number of people entering Medicaid now that it's going to be available for any adult under age 65 who is under 133% of the federal poverty level. Our Medicaid population in Virginia will grow from 270,000 to more than 450,000 by 2014. So the questions that we need to answer are this: how do we provide access to care? How do we provide quality of care? How do we reduce the costs and the inefficiencies that are now present in taking care of patients so that all of these new patients can come into our system and be served in a comprehensive manner? There was a lot that children got out of the Patient Protection and Affordable Care Act. Some of the things that were really positive were that no longer can a child be denied insurance because of a pre-existing condition. We now have Bright Futures, our health prevention guideline benefits that are covered without a copayment, and many other benefits that are looking at children and what their unique needs are in healthcare. Some of the problems and some of the questions come from how that is going to be implemented. One big issue is about the grandfathered healthcare plans, the healthcare plans that existed before health reform became law. And in those plans, we don't know what's going to be covered and what isn't. And what's even harder is in your office, you don't know if your patient has one of those grandfathered plans or if they have one of the newer plans that have to abide by the healthcare reform guidelines. So that's difficult. The other difficulty that I'm envisioning with the health insurance exchanges is that the health insurance has to cover at least 60% of the cost of health care, which leaves parents with 40% of health care, and a lot of parents can't afford that. So what I'm afraid that might happen is that underinsurance will become the new uninsurance. If you're uninsured, you might not be able to afford the care that your child needs.